what it was like learning how to play your favorite sport or learning steps to a new dance? Wasn't it great to have someone there to teach you? Now that you want to learn how to use the SoloSTAR pen pre-filled with Lantus, we're here to teach you how to do it in 6 easy-to-follow steps. Prescription Lantus is a long-acting insulin used to treat adults with type 2 diabetes and adults and children 6 years and older with type 1 diabetes for the control of high blood sugar. It should be taken once a day at the same time each day to lower blood glucose. Do not use Lantus to treat diabetic ketoacidosis. Please see important safety information for Lantus at the end of this video and full prescribing information at the link above. Before we start the steps, let's take a look at the different parts of the pen and the needle. The Lantus SoloSTAR pen is gray, has a flat, smooth injection button, and is filled with 300 units of Lantus, a long-acting insulin. This is the pen cap. The pen cap protects the pen when you're not using it. When you remove the cap, you can see the rubber seal, which protects the insulin in the pen reservoir. The dose window has large, easy-to-read numbers, so that you can clearly see the dose you're dialing. The pen needle has an outer cap, an inner needle cap that covers the actual needle, and a protective seal. Pen needles are not included with the pen. Lantus SoloSTAR is compatible with Becton Dickinson ultra-fine pen needles. Before we start with step 1, here are some important reminders about using the pen. Store unopened Lantus SoloSTAR pens in the refrigerator until expiration date. You can also store unopened pens at room temperature, but only for 28 days. Before injecting, wait until the pen has been out of the refrigerator and warms up to room temperature, so the insulin in the pen will feel more comfortable when you inject it. After opening the pen, you should not refrigerate it, and you can use it for up to 28 days. Always attach the needle first before dialing the dose selector, and always use a new needle. Always wash your hands with soap and water before an injection, and remember to clean the injection site with alcohol. Now let's go to step 1, getting ready for an injection. Remove the pen cap. Before beginning, check to see that the insulin in the pen is clear and colorless. The insulin in this pen is clear, so it's okay to use it. If it is not clear, or if it has particles, do not use that Lantus SoloSTAR pen. Use another pen, or call the 24-hour helpline at 1-800-633-1610. Okay, now you've completed the first step. So let's go on to step 2, attaching a needle. First, remove the protective seal. Then, holding the needle straight, screw it on snugly, but don't make it too tight. If you have a push-on needle, keep it straight as you push it on. Never hold the needle at an angle when screwing it onto the pen. After you've attached the needle, take off the outer needle cap. Save the outer needle cap because you will need it later to safely remove the needle after your injection. Now, take off the inner needle cap and throw it away. Now let's move on to step 3, doing a safety test. First, dial a test dose of 2 units. Now, holding the pen with the needle pointing up, gently tap the reservoir so the air bubbles rise up to the needle. Then, press the injection button all the way in, and check to see that insulin comes out of the needle. The dial will automatically go back to 0 after you perform the test. If no insulin comes out, repeat the test 2 more times. If that doesn't work, then use a new needle. If no insulin comes out after you've changed the needle, do not use the pen. Use another pen. All right, we're already halfway through. So let's go on to step 4, selecting the dose. Dial the dose your doctor has prescribed for you. For this demonstration, we're dialing a dose of 10 units. A great feature of the Lantus SoloSTAR pen is that if you dial too little or too much, you can dial back up or down until you reach your dose. but the dose can't be dialed past the number of insulin units that are still in the pen. The pen has an automatic safety stop at 80 units. If you need a dose of more than 80 units, then you must give yourself another injection. Use a new pen needle if you need to give yourself another injection. You must always attach a new needle and discard the one you just used. Now let's go on to step 5, injecting your dose. Injecting with the Lantus SoloSTAR pen is easy and takes seconds to do. The Lantus SoloSTAR pen uses a very thin needle that you can inject in the upper arms, the abdomen, or the thighs. Keeping the pen straight, insert the needle into your skin. Using your thumb, press the injection button all the way down. Then, slowly count to 10 to make sure that you get your full insulin dose. After counting a full 10 seconds, release the button and remove the needle from your skin. Congratulations! You've learned how to inject yourself with the Lantus SoloSTAR pen. Now let's go to the last step. Step 6. Removing the needle. Put the outer needle cap back on the needle and use it to unscrew the needle from the pen. If you have a push-on needle, then pull the outer needle cap from the pen. Discard the needle and the needle cap the way your healthcare provider told you to do it. You can use a sharps container or visit www.safeneedledisposal.org for other safe ways to dispose of used needles. Put the pen cap back on the pen and store it in a safe place. With practice, you can do this. But if you forget a step or two, just play the video again. You can also read these injection instructions in the full prescribing information at the link above. Indications and usage for Lantus. Insulin glargine rDNA origin injection. Prescription Lantus is a long-acting insulin used to treat adults with type 2 diabetes and adults and children 6 years and older with type 1 diabetes for the control of high blood sugar. It should be taken once a day at the same time each day to lower blood glucose. Do not use Lantus to treat diabetic ketoacidosis. Important safety information for Lantus, insulin glargine rDNA origin injection. Do not take Lantus if you are allergic to insulin or any of the inactive ingredients in Lantus. You must test your blood sugar levels while using insulin, such as Lantus. Do not make any changes to your dose or type of insulin without talking to your healthcare provider. Any change of insulin should be made cautiously and only under medical supervision. Do not dilute or mix Lantus with any other insulin or solution. It will not work as intended, and you may lose blood sugar control, which could be serious. Lantus must only be used if the solution is clear and colorless, with no particles visible. Do not share needles, insulin pens, or syringes with others. The most common side effect of insulin, including Lantus, is low blood sugar, hypoglycemia, which may be serious. Some people may experience symptoms such as shaking, sweating, fast heartbeat, and blurred vision. Severe hypoglycemia may be serious and life-threatening. It may cause harm to your heart or brain. Other possible side effects may include injection site reactions, including changes in fat tissue at the injection site, and allergic reactions, including itching and rash. In rare cases, some allergic reactions may be life-threatening. Tell your doctor about other medicines and supplements you are taking because they can change the way insulin works. Before starting Lantus, tell your doctor about all your medical conditions, including if you have liver or kidney problems, are pregnant or planning to become pregnant, or are breastfeeding or planning to breastfeed. Lantus SoloSTAR is a disposable pre-filled insulin pen. Please talk to your healthcare provider about proper injection technique and follow instructions in the instruction leaflet that accompanies the pen. Please see full prescribing information for Lantus at the link above. Learn more about the benefits of using Lantus SoloSTAR pre-filled insulin pen at www.lantus.com, where you can also download this presentation in an easy-to-read, illustrated format.